Good evening, dear viewers, and good evening, Abdullah.
Good evening, Dr. Fatima.
Welcome to a new episode of Medical Talk, the program that brings you trusted medical knowledge to help you and your family live healthier and safer lives.
Nowadays, medication and supplements have become part of many people's daily routines. Painkillers, antibiotics, vitamins, energy boosters, and even herbal products are often taken without proper medical advice.
However, unfortunately, many people assume that if a product is available without prescription, then it must automatically be safe. But in reality, misuse of medications and supplements may sometimes lead to dangerous complications, drug interactions, or delayed diagnosis.
Also, social media has played a major role in promoting health products and supplements, making it difficult for many people to distinguish between medical facts and marketing claims.
So to help us better understand the hidden dangers of self-medication and the truth behind modern supplement use, we are pleased to welcome Dr. Kholoud Kotait, clinical pharmacist.
So, dear viewers, stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatma Al-Ansari, and you're watching your weekly show, Medical Talk. Welcome, dear viewers, to another interview with Dr. Kholoud Kotait, clinical pharmacist. Thank you for being here with us today.
Thank you so much. Thank you for having me.
Thank you for being with us, Dr. Kholoud, today.
Thank you. Thank you for having me.
So let's start, Dr. Kholoud, with an important question. How common is self-medication today, and especially in our region, the Middle East?
Honestly, when we come to this topic, we can talk about it all day. So thanks for the question. With self-medication, usually patients tend to find it easier to self-prescribe. Simply because usually some medications are over the counter, as we know.
True.
We don't usually need prescriptions for a lot of things that are, day-to-day needs. So they feel like, self-prescribing is easy. And sometimes, for example, if they have a symptom and their sister has the same symptom or someone from the family member, they tend to, oh, okay, my sister took this. So they tend to self-prescribe, not even by going to the pharmacy and buying it themselves. They will see whatever they have at home.
Yes.
So it's honestly very, very common, but this can cause a lot of problems for themselves and also for the family members when we talk about like the medications, expiry, and so on. So there's a lot of,
Sure. Especially maybe in this region, people need more awareness maybe regarding this topic, self-medication.
Exactly. So I feel like as a start, whenever anyone is sick, first of all, they don't go to their, the shelf at home and check for even simple things, even paracetamol, in the different brands that are available. Sometimes, adding more medications that you think is normal could cause a lot of side effects for yourself, and as well during, for example, they don't know when to take the dosing and so on. So to aware everyone about the medications, number one, we shouldn't self-prescribe. When we feel ill or we feel sick, first thing to do is to visit the doctor before the pharmacist. I am a clinical pharmacist, and sometimes, for example, I don't work as a pharmacist here in Kuwait, but I see how in the pharmacies they go in and they tell the pharmacist their diagnosis, and they think the pharmacist can directly prescribe. However, in our region, this is not okay, and this is not really familiar.
Some people say, my brother took this medication, I should be fine if I took it.
Exactly.
But they don't realize the side effect depends on the person.
Yes, exactly. And I feel like in our region, it's very easy to visit the doctor, to get a consultation, and it's very, very simple.
Yes.
So step number one is to visit the doctor, okay, the nearest doctor. And then after that, the doctor prescribes certain medications. So we need the patient needs to follow. After for example, sometimes, the box of tablets has more than the medications that we need. And usually when, it's prescribed from the pharmacy, they write, for example, 14 days. So usually there's 3 remaining tablets. So even for that, we have to be very careful, because these are the things that cause the self-medication for the sisters and the brothers and all of the family members at home. So I feel like step number one is that when you're prescribed a medication, you're going to take it and keep it for yourself. Later on, if you're visiting the doctor and you need another medication, then you tell them, I have 2 tablets of this, for example, and you would want to memorize, to be honest, or you just get rid of the medication. And there are different ways now to get rid of medication. You can go back to your pharmacy and give it back, and there's a lot of different ways to do so. But I feel like step number one is to not reuse whatever you used before.
A lot of people use the same pharmacy at home. They put all the family's medicine together.
Exactly.
So everyone should keep their medications separate.
Separate,
Very,
yes.
very separate. Yes, I agree.
Definitely. Thank you, Dr. Kholoud, for that amazing advice.
Yeah.
But what is the mentality behind certain people being so comfortable at taking medication without consulting any medical or healthcare professional or a pharmacist?
Okay, to be completely honest, they think about the consultation and the price they have to pay for the consultation. I feel like the price is number one.
Yes.
Even if you check for different hospitals and clinics, the first question everyone gets is, how much is it on the phone? So I feel like they don't want to pay, or they feel like, you know, if they have the medication or they have a family member who's a doctor as well, so they would tend to go on that path. But I feel also there's nowadays, after everything we've been through, some people are a little bit lazy, I must say.
Yes.
To be honest.
So they just grab whatever they have at the
they
house.
just grab. And also, if they see that they have the same symptom as someone else in their family or friends or in school, even, by the way, yeah, in schools, this is a disaster.
Yes.
Because I see it with a lot of my family members. They just give each other medications in school.
Yes, it is very
Yeah,
common.
you have a cold, I use this, you can use that. So
But they don't know if there's a side effect affecting the other kid. They will take responsibility
exactly,
for it.
Yes.
exactly, yes. So this is, I feel like that these are the main two reasons. But I feel like once we spread the awareness, which we're trying to do, everyone's going to be more and more aware of of the side effects and of how to use the medication properly. So I feel like with more awareness, people are going to stop doing that. To be
Yes.
honest, yeah.
Well, actually, even at the clinic where I work, I always encourage patients to go to the free clinic because, and as you said, they do feel sometimes lazy to drive, but I always encourage them, make sure to talk to a doctor, and the free clinics are available to go get a consultation before taking any, you know, any medicine.
Yes, that's true.
Dr. Kholoud, as a clinical pharmacist, I think this is an important question. What are the most misused medications as a clinical pharmacist?
Okay, so we don't want to talk a lot of, I don't want to talk like medical
About
words,
about a specific
or
drug.
different brands, but in general, I feel like painkillers, everyone's familiar with what are painkillers, and there are different types. So I feel like this is the most misused medication because whenever anyone feels pain in any part of their body, they just tend to take like the painkillers in different concentrations and different doses.
Yeah, it depends on their mood, I guess.
Yes, and sometimes they're not aware that there are different classes of the painkillers. So I feel like with painkillers, it's the most misused, and as well as that we find that this is the most medication that there are side effects.
Yes.
You know, it causes a lot of, liver issues and so on with the increased use of it, and that the intervals of each medication is not proper. Sometimes people are not that patient. So if they have pain, they want the pain to go away now, or after 5 minutes. Maybe the pain will go away in 30 minutes, in 1 hour. So they're not waiting for that period. So I feel like this is the most misused because someone's feeling, especially if they're not from the medical field, they feel the pain, they're uncomfortable. So what to do? I need to take it now. Oh, it didn't work. Maybe I need a higher dose.
Yes.
And most of these medications are over the counter.
Yeah.
So I feel like this is the most thing that's misused, to be honest. Yes.
I tell the patients all the time, please be patient when you take any painkillers.
Yes.
As you said, a lot of people have no patience. They think that pain will go overnight or will be subsided within a few hours, and then they're surprised that they have pain the next day. So that's why they need to have a proper diagnosis to know why is the pain there, and then be patient, definitely.
Yes. And to add on that as well, they need to understand that sometimes a painkiller might work today and might not work tomorrow.
Definitely, yes.
So we need to change, the class or the type. So when we change that, usually they don't change it. They just increase the dose. And this can cause side effects.
Side effects and
and
other
this is
problems.
the issue. Yeah.
Dr. Kholoud, thank you so much for answering the question amazingly so far.
Thank you
but,
so much.
Dear viewers, we're going to take a short break and we'll be right back with Dr. Kholoud. Welcome back, dear viewers, with our interview with Dr. Kholoud Kotait. Dr. Kholoud, antibiotic misuse continues to be a global concern. So why is taking antibiotics without proper medical guidance is considered dangerous?
Okay, to begin, we need to understand that there is a bacterial infection and there's a viral infection. So usually what we know by the books that antibiotics are given for bacterial infections. But in our day-to-day use, we don't just use antibiotics for bacterial infections. They're used as well for viral infections, however, specific types. So how are they misused is that, first of all, we need to understand that different doctors come from different schools. So some doctors prescribe the antibiotics for certain viral infections. However, some doctors are like, no, you're not supposed to prescribe that. And I feel like this, you know...
it's confusing patients.
This is confusing patients, but I feel like it's because there's a lot of viral infections and then there are a lot of bacterial infections. And usually we're not able to know if this is a viral infection or a bacterial infection until we do a blood test. And patients don't usually, you know, when you have a cold, are you going to go do a blood test?
No, they need the results. They need results now.
Exactly. It's not familiar nowadays. So usually what they do is that they're going to take whatever they have at home, or they usually just consult whatever their friends and so on. And some medications are over the counter, some are prescribed. So for that, I would say step number one is that when we have a flu or a cold and so on, there are certain antibiotics. We're not going to talk about brand names, but there are certain active ingredients that are common in the market, like amoxicillin, for example. These things are general, okay? So will you be able to go to the pharmacy and get them? Yes, and it depends on the dosing and all of these things. However, you're able to. So I feel like you could always go to your pharmacist in the pharmacy and get that. But however, it's always better, especially that, you know, we have a lot of viral infections and we came out of the coronavirus and all of these things, and our immunity is not the best. So I feel like we should first consult the doctor again before the pharmacist. And if we do really need, we need to take a blood test. Because if you start increasing the dose of the antibiotics, you will start getting resistance. So with this resistance, some patients will come to you, it's okay if I have resistance. Okay, later on, if you have a viral or a bacterial infection and you do need to take the antibiotics, you're going to have resistance for it. So there's no, you know.
So this medication will no longer work on this person.
Okay. Yes, besides all of the adverse effects within the liver and the kidney and all of these things. So it's very, very important to, again, consult the doctor. We're going to repeat this many, many times, I feel like today. We're going to consult the doctor first.
Because people need to understand this part.
People need to understand, you know, a 10-minute, you know, consultation and drive to the nearest doctor, whether it's paid or unpaid, it's beneficial for you. And you have to consult the doctor.
And every cold and flu is different. So let's say some patients, they would probably think, oh, 4 months ago I had the same flu. They would probably forget some of the symptoms. So that's why they need to go to a doctor and run by them the symptoms again to know properly which medication is that would work better with them.
And I feel like for everyone to understand more of what we're trying to say, if they want to compare, you know, 2020, 2021 and the coronavirus,
they think they're all the same symptoms and
exactly, but the medications were always different.
Definitely.
Always. And some people were in the hospital, other people were at home, other people were not feeling that, you know, that the medication's working for them. So again, this is where it comes to, with not just antibiotic resistance, you can get, you know, your immunity, it's going to play a huge role. So this is, in the long run, with antibiotics, it could get, to be honest, a little bit dangerous.
Dr. Kholoud, how risky is it combining medication with supplements, herbal remedies, and vitamins?
Okay, so I would say my issue is only the gummies that are available everywhere and anywhere. So with these gummies, unfortunately, they taste, fortunately and unfortunately, they taste good. So if a patient needs to take it, they're not going to feel uncomfortable. However, because they taste good, so it's very easy for them to just, you know, take 1, 2, 3. So I feel like they, you know, with the supplements, it gives me a little bit of, I'm unhappy with these gummies and supplements that are available in the market, to be honest.
Yes.
Because they're combining them with the medications they're already using. So for example, you could have a male patient who is 40, 50, 60 years old. Each age group has different dosing. The gummies might have good dosing for specific active ingredients that are already within the medications they're using. And then especially if they have comorbidities, heart failure, asthma, and all of these things together, the drugs will interact. So you will see that, for example, you will have when you go to your heart doctor, the results are not, you know, progressing or so on, because the medication is not working at its optimal level because of this misuse or of the drug interactions.
Yes.
Because it tastes good, people might
Exactly.
overdose
Yeah.
on these. Yeah.
And you know, by the way, it's not just with medications, like as in tablets and so on, even with creams. You know, dermatological creams, hair tonics. You know, when you visit the dermatologist, there's always a way to put your creams in a specific order,
Yes.
in a specific concentration. When you
Yes.
visit this dermatologist, for example, and you have a scar and you want to heal it with a certain cream, and your friend also has the same scar, however, the cream for your friend might be different than your cream. And the way you're going, the number of times you're going to apply it per day might differ.
Yeah.
So when we talk about medications, it could also be with skincare.
Yes, definitely.
You know, it's not
because
just
it's
those.
medicine, definitely.
Exactly.
Yes.
It's still medicine at the end of the day. Even
Yes.
if you can just grab it from the counter, it's still medicine at the end of the day. Yeah.
Dr. Kholoud, we know that social media influencers sometimes they promote supplements or wellness products. How can people know which supplements are actually useful and which may be misleading or not beneficial for them?
Yes, yes. Okay, so everyone's sometimes now against AI tools in general. I feel like they can all, I'm with the AI tools. So they need to search the basics. The basics, they need to search it. They look at the active ingredients, ask the AI tool to simplify the terms for you. And then you're going to eventually, you know, we're all educated. It's very easy. The AI tool can give you in
Yes.
general.
Yes.
And then if you need, and if you don't understand more, usually the social media influencers will not prescribe medications. It will be creams and so on. So things that if there are side effects, we can cure. Thank God.
Yes.
So I feel like, first of all, yeah, they need to check just to know the basics. You know, on the search engines, they just search and know the active ingredients. And then if they need, they can consult, of course, the doctor or even the pharmacist. In that case, I'm okay with, you know, giving
So
my
if
opinion.
they saw an ad or someone promoting something, they need to check first. Either way, you
check
can't
first.
trust anybody online.
Exactly, exactly.
Dr. Kholoud, thank you so much for answering these questions so far. But dear viewers, we are still continuing with this interview after this break.
Dear viewers, we are back again with Dr. Kholoud Kotait. Dr. Kholoud, so our final question, what is the most important advice you would give our viewers about medication and supplements?
Okay, I feel like our viewers would say that I would recommend that they visit the doctor first
Yes.
before going to the pharmacy. But I feel like I wanted to take it more, you know, personal. I feel like when they walk into the pharmacy or the doctor's office, the advice I would say is to not insist on a certain medication. Some patients walk in and they actually ask from the doctor to prescribe a certain medication because it worked for someone else.
Yes.
So I feel like this is one of the main advices. And I feel like to add on that is to be, you know, a little bit calm and nice to the doctor and the pharmacist. Because sometimes we get a lot of stress when it comes to the patients are all coming at one time, and there's usually, you know, different we put appointments and everything whenever, if it's in the hospital or in the pharmacy, there's usually a lot of people. So the patients or they get a little bit, you know, anxious and annoyed and frustrated. So I feel like I want to advise them that to be a little bit calm, to understand that there is a human behind the pharmacist and the doctor, and that they're doing their best to give you the best treatment they can.
Yes.
And if something is out of their hands, then it's out of their hands.
Definitely.
Yeah, so sometimes they walk in, okay, my appointment is at 3 o'clock, or my appointment is at 4, and I'm walking in even like 1 minute late or 2 minutes late, or at the pharmacy. Why can't you just give it to me? It's right there. You can. So there are certain procedures that the pharmacist and the doctor has to go through.
Yes.
So feel like there should be a little bit of, understanding that there are certain rules and regulations, and some
Yes.
things are not within our hands as pharmacists or as the doctors in the hospitals, to be honest.
And the doctor needs a lot of concentration to listen to the
Exactly.
patient's problems
Yes.
in order to give them the proper medication.
Yes, and usually, there isn't any breaks in the middle.
Yes.
So, please be understanding of the situation and of how really the doctor also has, personal life, wants to be happy, and sometimes are working beyond and beyond the hours to
Yes.
serve and
Yes.
to give you the best treatment. And the problem is with our field is that we really need to focus. There should be 100% focus all the time. We don't have an option of not to focus for 99%. It
Yes.
doesn't happen. We need 100% of focus. So I feel like this is also something that, if please, as patients, to be, nice and know that there's
Considerate.
and considerate, yeah, and to know that there's a human behind, the doctor or the pharmacist.
Certainly, certainly.
Yes.
Especially if the doctor is stressed or working overtime, we need to be considerate with. In the end, we're all humans, and we
Yes.
all have these
Yes.
kind or bad days sometimes. So
Yes.
please, dear viewers, be kind and respectful to your doctors. Well, Dr. Kholoud, thank you so much for being with us today. It was an honor having you on the show.
Thank you so much. Thank you for having me.
Thank you for coming.
Thank you.
Well, dear viewers, that brings us to the end of this interview, but we still have more segments on the program after this break.